Senate Committee on Health, Education, Labor, and Pensions will please come to order. This morning, we're holding a hearing on continuing America's leadership, realizing the promise of precision medicine for patients. Senator Murray and I will each have an opening statement, then we'll introduce our panel of witnesses who are getting to be very familiar to us. We're grateful for you for coming. After that, we'll have time to ask 5-minute rounds of questions, or two, depending on how many senators are here. We're here today to discuss an exciting new direction in our health care called precision medicine. What does that mean? Well, if those of us in the room were a good representation of the United States population, the Centers for Disease Control and Prevention estimates that nearly 1 in 10 of us would have diabetes. If doctors could use precision medicine, that is, if they could look at our individual DNA and the genetic and molecular makeup of our disease, perhaps they could then potentially tailor treatments to each individual rather than to more general category of diabetes. I was visited this morning by the head of Philadelphia Children's Hospital, who talked about their work in identifying a defective gene or mutated genetic defect that causes blindness, and how they have developed a therapy that restores the sight in a child because of the therapy directed for that specific genetic defect. This is happening with cancer treatment. Doctors can look at the mutations of the cancer cell and assess how to treat it. Newsweek reports that genetic testing on tumors is already starting to become the norm in the big cancer hospitals like Sloan Kettering, Dana-Farber, MD Anderson. All incoming patients automatically have their tumors sequenced. This is all possible because of extraordinary achievement by a great many individuals on sequencing the human genome, none more important than Dr. Collins, who is here with us today. We're grateful for that. So today we want to discuss what the National Institutes of Health and private industry are doing in precision medicine, how the Food and Drug Administration will regulate those innovations, how electronic health records can affect our ability to innovate, and what this means for the American patient and our healthcare system. It's one of the most exciting new frontiers in medicine. Senator Murray and I are working on an initiative to ensure that our federal agencies are equipped to review the medical products and processes produced by this kind of cutting-edge medicine so that American patients aren't waiting on the sidelines because regulatory science can't keep up. Our innovation initiative is not just about precision medicine, but precision medicine is an important part of our initiative. President Obama announced a precision medicine initiative in the State of the Union this year. He detailed his plans in an event at the White House. I attended that to demonstrate my support for it. The President has proposed, as part of his plan, mapping the genomes of 1 million individuals and making that information available to medical researchers across the country. We look forward to hearing more about that from our witnesses. I know there's similar private efforts underway, and I'm interested in hearing about that competition and about possible collaboration. For example, the Children's Hospital of Philadelphia that I mentioned has 250,000 individual children genomes sequenced there. And I wonder how useful that would be to the 1 million that Dr. Collins is putting together, how these scientific entrepreneurs, Dr. Ventnor in California, Philadelphia, other places, how that relates to the President's proposal for 1 million individuals. I look forward to hearing about the potential cost of precision medicine. We know that costs to sequence the human genome have been reduced significantly in the last 2 decades. Dr. Collins testified, I believe, that he said 15 years ago it cost us about $400 million to sequence the first human genome, whereas today it's about $1,000. Very often in healthcare, innovation initially increases our costs. That doesn't mean we shouldn't innovate. Innovative new products can increase costs, but in the long term actually decrease healthcare costs. Take Alzheimer's, which according to the Alzheimer's Association will cost us $226 billion this year, along with other dementias. And if we could use precision medicine to delay onset or cure that disease, we could save precious dollars in our healthcare systems and alleviate some of the grief and the pain associated with it. The committee has also spent some time and will spend more on improving electronic health records. The federal government has spent $28 billion to drive the adoption of these record systems, and the result is that doctors don't like the systems. Many say they disrupt workflow, they interrupt the doctor-patient relationship, and haven't been worth the effort. Senator Murray and I have begun a working group to identify the 5 or 6 things we can do to help make the failed promise of electronic health records something that physicians and providers look forward to instead of something they endure. Dr. DeSalvo, we look forward to working with you on that and with Secretary Burwell and being able to report maybe early next year some results, either that you take administratively or that we do legislatively or some of both. We have to get to a place where the systems can talk to one another, interoperability, and where doctors, particularly smaller physicians' offices, want to adopt the systems, can afford the cost, can be confident their investment will be of value. Dr. Collins has told us, and I've heard from many others, that a properly functioning electronic medical record system is tremendously important to the President's Precision Medicine Initiative. Number one, it can help to assemble the genomes of the 1 million individuals. And second, if we want to make genetic information useful, this is complex stuff. It's going to take computers that operate easily and with a click of the mouse to help make it possible for doctors to actually prescribe prescriptions for individual patients. I also would like to hear, if we know, Dr. DeSalvo, at some point, how the $11 billion effort by the Defense Department on electronic medical records would relate to the $28 billion we've already spent, and whether those will be compatible and whether you'll be working with them. So there's a lot to talk about today. This is a tremendously interesting and important effort, and I look forward to the witnesses' comments. Senator